And seeing cases even with these little newborns, where kids are having reflux and they're having rashes or eczema, infants.
Yeah.
And we talk to moms about, well, what are you eating? What are you ingesting? What are you doing? Or kids in the toddler years and, you know, developing eczema, asthma, allergies. And a lot of times it comes back to, sometimes elimination, or we see inflammatory markers that are very high on patients. And we don't know why. So we start thinking of like, what's causing the inflammation? And a lot of times it's what we put in our bodies, what we're exposed to and what we put in our bodies. And so when we do these elimination diets, it's not to say, oh, you have an allergy to gluten or you have a celiac disease, because we'll work up people for those things. But a lot of times it's negative. But we find that a lot of these foods like gluten and dairy are a little more pro-inflammatory. So maybe there are sensitivities and not necessarily food allergies. There's a distinction between food sensitivities and food allergies. So people that are manifesting the symptoms that you described earlier, like the vague symptoms of brain fog or headache or maybe some rashes or GI issues, they may have some food sensitivities. So when we start with what's most common, I always tell my students and other people that rotate with me and that common things happen commonly. And so when you look at gluten and dairy, those seem to be a big factor or player in a lot of these issues. So when we eliminate gluten and dairy, just that alone sometimes can be both diagnostic and therapeutic, right? I can diagnose the problem because they got better, and it's therapeutic because they're better. So a lot of times just by doing that with moms that are breastfeeding and their kids are having issues, we see the kids' issues clear up. Or as the kids are older, or even adult patients have issues that clear up when they do the elimination or do this clean eating. It can really help to reset